Man, no what I feel. He will not be behaving the way he's behaving. If you want us to take it one by one on combat, we will do so. We have been keeping patients over this.
Sickle Cell Patient and leader of the protesters, Charles Edigin, in a fit of anger when he discovered that the Permanent Secretary, Ministry of Health, Dr. Peter Ugbodaga, had ordered for the dismantling of the keys which they used in locking the entrance into the State Ministry of Health, making entry and exit impossible. The sickle cell patients, including their relatives, were armed with placards and set bonfire to express displeasure over the position of government on their health. The situation attracted the presence of policemen. Spokespersons for the protesters frowned at a situation where they cannot get access to adequate healthcare services in the State Sickle Cell Center in Benin City.
As I'm talking to you, we have lost more than 40 sickle cell sufferers to this crisis. They come in the afternoon, they rush and pack pounds of blood into them, ask them to go home. In a blood transfusion, you're supposed to take a blood transfusion for 6 hours to run. After the running, the patient has to rest for 24 hours before he or she can come down from the admission bed. The Commissioner for Health, he knows all this.
This place is supposed to be 24 hours accessible to the sickle cell sufferers, but it's not. You will find that they close by 4, which shouldn't be. They have beds here. We have written series of letters, like you can see, to the comrade governor. Not 1, not 2, not 3. He promises to come. He only acknowledges the letter, promises to come, and he never shows up.
You will be in your blood transfusion. You will come here halfway, you will go home. You will be on drip. See the children that came in this morning, they were all on cranula. It is not good, it is a risk. When they take care of them, they are satisfied that they are okay, they cannot go home. That is how it has been. That is how it has always been. That is how we want it to be.
The children are dying day in and day out. They can't afford all these drugs. The government should be able to subsidize the drugs for the children to live.
In a swift reaction, the Commissioner for Health, Dr. Ihanwa Ege, described some of the issues raised by the protesters as false, as she asserted that the Sickle Cell Center in the GRA is not an hospital, but a center for advocacy, research and counseling of sickle cell anemia, maintaining that the sickle cell patients can come there for check-up, after which they will be referred to our relevant hospitals for treatment.
We have one doctor who is here to help with counseling. If they have minor things, minor ailments that can be handled easily, yes, that is done. But it was never set up with the aim of creating a hospital for the treatment, particularly for admission of patients with sickle cell disorders. That was not the aim of this center.
The sickle cell patients, however, insist that there is no going back on their struggle until the state government provides adequate facilities for their upkeep. Wellington Kodeja reporting.